Today marks 4 years since the Dobbs decision, the Supreme Court case that effectively overturned Roe v. Wade and repealed the constitutional right to an abortion. Since that decision, states across the country have enacted their own laws, with 13 outright banning the procedure. Despite this, the number of abortions since the decision has actually risen. There were nearly twice as many abortions in the United States in 2025 than in 2021. That is due in large part to the rise in telehealth and the widespread practice of mailing abortion pills across the country. Access to the pill is the target of several huge legal battles in the states with abortion bans going on right now. Joining us now, abortion access correspondent for The Nation, Amy Littlefield. She's the author of the book, Killers of Roe: My Investigation into the Mysterious Death of Abortion Rights. It's good to have you on the show. I want to ask you about the book, but also the state of, let's start off with the state of women's health care as a whole, because it's not just the fall of Roe and access to life-saving health care that is abortion, and the numbers of cases that we've covered here on this show of women who have had their lives threatened, have been forced to give birth to dying or dead babies, and then, by the way, denied the access to ever create life again because they became sterilized in the process. That sick process has been playing out in this country ever since the fall of Roe. But also now the access to health care itself and the cost of it. Can you talk about the overall state of health care for women in America today?
Yes, thank you so much, Mika. It's great to be with you. I think this is a somber day when we have to hold two realities in our minds at the same time. 4 years after the Supreme Court overturned Roe v. Wade, the number of abortions has increased, but so has the number of pregnancy-associated deaths in states that ban abortion. One of those outcomes was entirely tragically predictable. The other one is surprising. So let's start with the surprising part, right? The number of abortions has gone up, and that's because of abortion pills by mail, because of brave clinicians in Democratic states mailing abortion pills into states where abortion is banned. No one thought that every year after the Supreme Court overturned Roe v. Wade, we were going to see an increase in the number of abortions. So that's really astounding. But we cannot lose sight of the fact that tens of thousands of people have been forced into pregnancy against their will because not everyone has been able to find out about or to access these options. And so what that means is that the latest data tells us there has been 68 additional pregnancy-associated deaths by the end of 2023 alone. There's always a lag in the data in states that have banned abortion. Now, 68 might sound like a small number, but I would argue that when we measure that in terms of mothers leaving behind grieving children, in terms of parents being forced to cope with the loss of daughters, in terms of partners leaving children, when partners losing their wives, when we start to look at this in terms of the scale of the human tragedy and the fact that these deaths were foreseeable and preventable, I think it's a number that should stop us in our tracks.
Well, in fact, your latest piece for The Nation is titled 4 Years After Dobbs, How Do We Count the Dead? You write, quote, 4 years after the Supreme Court overturned Roe v. Wade with its ruling in Dobbs, there's an image I can't get out of my head. Portia Gumezi was living in Texas when she suffered a miscarriage in 2023. Texas punishes medical providers who violate the state's abortion ban with up to 99 years in prison. After Gumezi showed up to the hospital bleeding and miscarrying at 11 weeks pregnant, ProPublica reported doctors delayed providing a simple procedure to remove fetal tissue, and so she bled to death. For months afterward, Portia's 3-year-old son would chase after women who looked like her on the street, shouting, "That's Mommy." That's the detail I can't forget. I can't stop imagining that little boy chasing after strangers on the street. And that story repeats itself. And I just wonder where this is going in terms of numbers and in terms of perhaps the dwindling numbers of doctors who will be brave enough to help women like this at their time of need. We're talking about basic health care to save a life.
Yes, exactly. We are talking about people dying when they're miscarrying because doctors are too afraid to intervene and save their lives. And I just want to mention a couple of other stories, right? Because it is these human stories, not just the numbers. We can become inured to numbers, right? But these human stories, right? Tierra Walker in Texas, she's suffering from high blood pressure and seizures from pregnancy. She doesn't want to leave behind her son, JJ, who's 14. So she tries to get an abortion, but she's not considered to be sick enough. And so instead of getting that abortion, Tiara ends up dying. Her son finds her draped over her bed on his birthday. Okay, these are the stories that we're talking about. Nevaeh Crane, 18 years old. Her mother has to watch her organs fail as she dies because she was sent home twice from emergency rooms in Texas. So we have to sit with these real human stories. I mean, there's a long time saying in the pro-choice movement that abortion bans don't stop abortions, they only stop safe abortions. I think in 2026, with the widespread availability of medication abortion, that saying needs an upgrade. What we know, what we have known for decades, is that abortion bans do not stop abortions. What they do is they kill women.
Abortion access correspondent for The Nation, Amy Littlefield, thank you very much. Amy's book, Killers of Roe, My Investigation into the Mysterious Death of Abortion Rights, is available now. And Adrienne Elrod, I'd like to turn to you on this issue and how Democrats position themselves. It's my belief that this should be brought into the affordability issue because we have the closing of rural hospitals across the country, the skyrocketing cost of health care. That's a universal, non-debatable issue that's impacting all Americans. The issue of abortion, of course, there's a huge debate in this country. It's often infused with false religious pretenses, and it becomes a sidetrack. At the same time, women's lives are in danger and they can't afford their health care. Is there a way Democrats can put that into words in a way that has an impact at the ballot box?
Well, Mika, I think you just answered your own question and you put it beautifully. We have to talk about, regardless of where you stand on abortion, right? Which, by the way, a significant majority of Americans support women being able to access abortions, even if they themselves don't believe in abortions for themselves personally. But we have to talk about it in the affordability lens because, you know, I think the author of this book just laid it out. Some of these stories that we are reading about and that are still happening every day that are not making headlines, where women are dying because they can't get life-saving care when they have an issue with their pregnancy. And even if they don't want to have an abortion, sometimes things happen and they have to, and you have fewer and fewer doctors who will perform them. And then you layer on top of that the fact that rural hospitals are closing down because of the affordability issue and because Trump is taking away funding from those rural hospitals. So I personally think, Mika, Democrats could do a slightly better job of sort of correlating these two. You know, we talk about affordability across the country. Candidates are talking about it left and right. They are meeting the moment in their own communities about how affordability issues are affecting their constituents. But in order to correlate the abortion access, lack thereof, to affordability is something that I think we could do, frankly, a better job of doing.